So patients will benefit, staff will be supported, and for taxpayers, the public, we're determined to ensure that every penny is wisely spent. Fortunately, we've got a lot going for us. We've got arguably the best value health service in the world already. The German health system costs 1/3 more per person than the NHS. The French spend twice as much as we do on administration, and NHS productivity has been rising faster than that of the rest of the UK economy. But we do still have opportunity for further efficiency, not only to ensure that the NHS gets good value out of the procurement deals and the medicines bill, cutting administration costs by another £700 million, but also an NHS that contributes to the economic success of this country, helping people stay healthy and get back to work, a vibrant life sciences sector, creating jobs and growth, and not loading onto the costs of our exporting businesses through a tax on jobs, continental European style, the cost of running the National Health Service. So, Prime Minister, in making the important commitment that you did, you set us last summer 6 tests for the NHS long-term plan, which today we deliver on. And you also gave us the opportunity to identify potential legislative changes for consideration by Government and Parliament. And again, today we do that. So, having published the plan today the work begins to implement it. We're going to be setting out the funding increases that every part of the country will see in the next few days, and then working with local clinicians and patients groups across the NHS on what this will mean in every part of the country. And as we do that, we believe that this will help us put the NHS on track, fit for the future for the next decade. An NHS that works for my parents' generation, with more than 1 million retirees over the next 5 years, and an NHS that works for our children's generation, recognising that 1 in 3 girls born today in the NHS are likely to live to more than 100. So there are big changes here, there are practical changes here, there are changes that are going to be widely supported across the NHS, and today we get on with them. Thank you. It's now my great pleasure to introduce the Prime Minister.
Well, thank you very much, Simon, for giving us that overview of the NHS long-term plan. And I'm delighted to be here with you all on this exciting occasion, because it's one that truly marks an historic moment for patients across the nation. And I'm pleased that this plan is being launched here at Alder Hey, a hospital recognised for delivering world-class care. It's over 100 years since Alder Hey first opened its doors to treat and improve the lives of our children, and much has changed since then. Advances in healthcare, from vaccinations through to drug treatments, have dramatically improved young people's health. But what has not changed is the extraordinary care and compassion of the hospital staff, something that I've just seen for myself on the general paediatric ward, where brave young children are treated with outstanding kindness and dedication, and of course, first-class medical care. And today, as we launch the long-term plan here at Alder Hey, we're taking a big step to secure the future of our NHS for our children and for their children. Now, I've always felt incredibly proud to live in a country with a health service that is there for all of us when we need it most, free at the point of use, based on clinical need and not the ability to pay, and there for us at every stage of our lives. And at the very heart of our health service are its staff. Time and again, our doctors, nurses and other health professionals have demonstrated why the NHS stands shoulder to shoulder with the best in the world. They're the reason why the NHS is one of this country's greatest institutions, an institution that is consistently what makes the people of this country most proud to be British. As a government, we've always recognised this unique importance of the NHS, and that's why in 2010, when we took office and had to deal with the record peacetime deficit we inherited, we prioritised the NHS with real terms increases in spending every year. And that money has delivered real improvements for patients. But demand for our NHS services continues to grow, and our health service faces increasing challenges from an ageing population with complex health needs. It also needs to transform services and exploit the opportunities provided by new technologies. NHS leaders told us that making the necessary changes in technology, workforce and infrastructure will take time and careful planning. And that's why last year, in its 70th year, I committed to an ambitious funding proposal to help make the NHS fit for the future. Not a one-off injection of cash, not money to plug a gap or shore up a problem, but funding to protect the long-term future of the NHS. Over the next 5 years, the NHS England budget will increase by £20.5 billion in real terms compared to today. And this commitment is possible because of our strong public finances and because as we leave the EU and take back control of our money, we will no longer be sending vast annual sums to Brussels. And crucially, we've funded this commitment with no increase to people's taxes. The NHS is the public's priority, and so I've made it my #1 spending priority. In return for this funding, because this is not just about money, I asked the NHS to draw up a long-term plan, one that was clinically led and locally supported, with an absolute focus on cutting waste and ensuring every penny is well spent. And as we've just heard from Simon, this is a plan that will set the vision for the NHS over the coming decade. So together, the 5-year funding settlement, along with the 10-year plan, will provide both the certainty and long-term direction needed to transform patient care and secure the future of our NHS. Now, as Simon has just referenced, last June I set out 6 priorities which I wanted to see central to the plan and which I'm pleased to see reflected today. A more integrated health system that views health holistically, organising care around the physical, mental and social needs of the patient and centring on what matters most to them. A health service that focuses much more on prevention and early diagnosis in order to address the needs of an ageing population. An emphasis on reducing variation between organisations across the NHS so that the world-class care available to some reaches all parts of the country. A service where the workforce are better supported and recognised as the lifeblood of our NHS. And I wanted to see the NHS make greater use of technology, not only to make healthcare safer and more effective, but to make the most of exciting new possibilities and give you greater control over your own care. And that means everything from being able to monitor conditions from the comfort of your home to accessing your GP via your smartphone. Finally, I wanted to see the NHS go further than ever before to ensure mental health gets the proper attention it deserves, putting it on a par with physical health. So we're reshaping the NHS around the changing needs of patients today. The long-term plan delivers against each of these 6 priorities and much more, with actions backed up by record investment. And precisely because the plan is over 10 years, we can go much further on integrating care and embedding technology than we otherwise would have been able to. But a plan is only as good as its delivery, and ensuring its benefits are felt by patients will require strong leadership and frontline support. And that means empowering the NHS workforce to deliver, encouraging leaders in each organisation to learn from the best and for the best to help others. And while many hundreds of people have contributed to the plan's development, over the coming months, a broader range of local NHS leaders and frontline staff will need to shape how it is implemented across the country. And I want to thank Baroness Dido Harding for leading on the workforce aspects of this. Not everything can be done at once, so as always there will be some careful choices to make. But delivered effectively, our long-term plan for the NHS will secure our health service for generations to come. Finally, I want to say a huge thank you to Simon Stevens, Ian Dalton, NHS staff, charities, voluntary groups and patients, and all those who've worked so hard and contributed to this plan, as well as to Matt Hancock and to his predecessor, Jeremy Hunt. This is an historic moment. Our vision is clear. Our commitment is assured. So let's deliver the NHS of the future. Thank you. Now, I will just take a few questions from the media. Laura.
Thank you very much, Prime Minister. You're here to talk about the NHS, and clearly this is a historic financial commitment that the government is making. But some of the people protesting outside here this morning worry that the health service will be one of the things which suffers if you don't get Brexit right. Now, before Christmas, you realised your plan did not have the support to get through Parliament. What evidence can you give us today that anything has really changed? And if I may, you repeat the claim that sums going to the EU currently will go to the NHS instead, but your own government forecasts have said time and again that the economy as a whole will be smaller. So isn't it misleading to keep making that claim?
No, first of all, on that claim, it's very simple. We currently send significant sums of money to the European Union every year. In future, that money will be available for us to spend on our priorities. And clearly, as I've set out, the NHS is our key spending priority. But in terms of where we are on the Brexit issue, yes, we did delay the vote before Christmas. The debate will be starting this week in Parliament, as I'm sure you know. In the intervening period, of course, there was December European Council immediately after what would have been the vote. And at that, there was some further movement from the European Union. But I've been speaking to European leaders in the intervening period, speaking to colleagues. I'll be continuing with that, talking to colleagues, listening to colleagues, and speaking to European leaders. And in the coming days, what we'll set out is not just about the EU, but also about what we can do domestically. So we'll be setting out measures which will be specific to Northern Ireland. We'll be setting out proposals for a greater role for Parliament as we move into the next stage of the negotiations. And we're continuing to work on further assurances, on further undertakings from the European Union in relation to the concern that's been expressed by parliamentarians. Emily?
Prime Minister, this plan appears to be all about prevention and better community care, but how can you possibly deliver on that when local authority budgets have been slashed so much? Will you guarantee that local authorities will get more money for social care and for public health services?
Well, of course, we're already putting more money in for social care to local authorities. But I'm slightly challenged. This plan is an overall plan for the NHS over the next 10 years. You indicated you thought that it was just focus on certain areas. Yes, it is about prevention. It's also about better early diagnosis, better detection, treatment and recovery, so that we can ensure better outcomes for people from conditions from which they're suffering. It's about making sure that at every stage of life, the NHS is delivering that world-class care for individuals. So we want to make sure that we're providing the best maternity care in the world, for example, giving every baby the best possible start in life. I've seen here today a little 7-week-old baby who has had fantastic care here at Alder Hey. But we want to make sure that as things go forward, we can continue to provide absolutely the best care at every stage in life and make sure that that ageing population are able to live healthier lives, more independent lives for longer. Yes, there is about the NHS and how it works with local authorities and how it works with other organisations. But it's also at the heart of this is ensuring that this is an NHS that, with this long-term plan, is showing that it can develop the services, the facilities, the capabilities that we need to ensure that we continue to be that great health service and up there as the best in the world. Sophie Borland from the Mail. Where did I see Sophie?
Hi. Prime Minister, what areas of waste would you like the NHS to tackle to improve its efficiency?
Well, let me give you a couple of examples in this area. First of all, it's estimated that any one point in time, something like 20 to 30% of people in hospital don't actually need to be in hospital. Now, actually, if they were being looked after in a more appropriate setting or getting more appropriate treatment for them, then that would actually be better for them. Also, actually, it releases that what is quite expensive at the expensive end of the NHS treatment, keeping people in hospital. So that's just one example. But then I thought, actually, on my visit today, I heard of another example where, because what hospitals and NHS are doing themselves is looking at how they can provide better services and save money. And David referenced the fact that, as I heard, there is now a chef on every ward in Alder Hey. That means the children get the meals when they want to eat. They get the food they want to eat. It's freshly prepared for them. It's much better for them. And hey, it saves money. So, there are many ways in which the health service can look at these issues. And I think the last question I'll take is from Chris Smythe from The Times. Where's Chris? There.
Thank you. For all the fascinating things that are in here, one thing that's conspicuously not is any commitment to meet the NHS constitutional waiting time targets for A&E and routine care. Can you reassure patients that the review that's going on to that is not just a way of watering down those targets and making them wait longer, or are you saying that one of the careful choices that needs to be made in a health service focused on prevention of primary care is not fetishising hospital waits anymore?
No, we're very, very clear. Look, what has happened in relation to the targets in the NHS? We're actually seeing the NHS treat more people. We're actually seeing the NHS deliver services and care to more people. But the demand has even as that's more people are being treated, the demand has outstripped that. So we have been slipping against the targets. We do need to see efforts in terms of performance and improving that performance. But what the long-term plan is about is saying, actually, what are the right sort of targets that should be set for the future? We and the NHS leaders, we've agreed NHS leaders can look at that question, but everything needs to be based on clinical evidence. It needs to be based on what is right for the patient. So yes, we do need to look at the performance against the existing targets, but as we're looking ahead for the NHS, let's make sure that we're setting the standards that are right standards for the future as well. Thank you.